DiaBeat participants, and all those who log in post-webinar. Good morning. Today is the 20th of September, and this is our sixth webinar. Our topic, diabetes and holistic care. Now, in past webinars, we have listened to Dr. Hala and Dr. Humam, are accredited medical doctors who deal with this subject and other related subjects. And through them, we know about allopathic medication for diabetes, and we also know about the relevance of diet, exercise, lifestyle change. These things we have been made aware of, and we pay attention to that. But we also hear about other remedies which we are not very knowledgeable about. We know about home remedies, herbal remedies, supplements, alternative therapies, but we don't have information from a specialist to help us to understand these better. Now, in home remedies, we know about, some of us have heard time about bitter gourd or karela, ginger, garlic, curry leaves, neem leaves. We hear about these things. And it's been passed down from generation to generation. Herbal remedies, which comes from the eastern part of Asia. Fenugreek, aloe vera, cinnamon, ginseng, these with abundant benefits. They are connected in some way, I am told, to diabetes. Now, more recently, we hear about supplements, vitamin D, vitamin B12, chromium, magnesium. And beyond all of this, we hear about the benefits of yoga, acupuncture, especially for pain in terms of neuropathy and diabetes, homeopathy, relevant in diet, relevant in yoga and exercise, naturopathy, homeopathy, I'm sorry, and independent problems for today. Friends, uh, friends, I'm not quite sure where I lost you. Dr. Wilco, could you tell me where exactly I got lost in this maze of technicalities?
Sir, you were talking about the alternative medicines.
Ah, okay. So we leave it at that. I was talking about alternative medicines, which I mentioned was a maze of information which we needed to understand far better. And there was no better person than our very own Dr. Wilku to help us with this. Now, Dr. Wilku is not only highly academically certified, but also vastly experienced. Let's talk about his certification first. He has, and I don't need to look at any paper to say this because I know Dr. Wilco personally, he has a homeopathy certification from UK. He moved countries. He has an ACLM certification from the United States, which means that he is certified in lifestyle medicine. He is one of the few people in our part of the world, in the UAE, who is certified in corporate wellness also from the United States. That not being enough, Dr. Wilku has done his MBA from India and his preventive and promotive healthcare from the prestigious Apollo hospitals. Now that's his certification. So he will give us a beautiful blend of the scientific perspectives of the various therapies that I spoke about. But he is vastly experienced. He is also vastly experienced. Very few doctors have his reach of over 65 to 75,000 clients. Over the last few years, since he has been in the UAE, since about 2012 or 13, over 65,000 corporate employees, over 12 to 15,000 school children. And he sees these young clients and corporate employees on a day-to-day basis in the ratio of 100. He has delivered over 2,600 talks on topics as varied as cardiac care and chronic disease management and so many other aspects. He has worked as a faculty with the with Gem Tata, with the Colon University in I believe in Orissa, with the Tata School of Nursing, and closer to home, he has worked with the RAC MHSU. He is a lead faculty in the postgraduate diploma program in wellness management. Naturally, and as a consequence, Dr. Wilku is highly awarded. And the one distinction that I must bring out is the International Award for Corporate Wellness Professional of the Year. Ladies and gentlemen, I present to you Dr. Wilku. Sir.
Thank you, Professor Kennedy, for wonderful words. It's really motivating. And with your guidance, with your mentorship, I have reached so far. Thank you very much for this, sir. So I will share my slides first. Is my slides visible?
Yes, Doc W. Yeah, it's perfect now.
Great. So welcome, friends. First of all, thank you very much for being a part of community health awareness programs on behalf of RAC Hospital for community around the world, especially we are focusing on UAE. Diabetes is one of the biggest challenges faced globally, we all know, which is largely a consequence of faulty lifestyle. That is the major thing. Then comes family history, medical history, or lack of physical activity, sedentary lifestyle, and poor health habits. Everyone knows about this. If we look the current scenario, 1 out of 5 individuals suffer from diabetes, whether they are pre-diabetic or diabetic. 1 out of 5 individuals. So alarming state. So today we are talking about the importance of holistic care for diabetes management. So let's start. Before we plan anything, we understand anything, we want to make a diabetic management protocols for ourselves, for family, for friends. Doctors used to guide us. We must understand what exactly diabetes is and how it impacts the body. Diabetes is a chronic metabolic disorder of abnormal insulin function, which happens due to either less or no insulin production or poor quality or ineffective insulin production. Third, which is very important, improper utilization of insulin by the target cells, what we call insulin resistance. And this is the major culprit for type 2 diabetes, what everyone is facing, most of the people are facing. Diabetes is classified into various types, and I'm sure my previous speakers from RAC Hospital, they have mentioned about all the types. So I'm not going into that detail for the types, but definitely I will talk about type 2, which is more related towards the lifestyle. So what exactly it does, how insulin works, and how glucose is being utilized. So now the point is, let's understand the physiology so that we can plan better. When we eat something, any food, when we eat, then it is being digested into the end product that is known as glucose. And there is a rise in the blood glucose after we eat within few hours, say max half to 2 hours. And then the beta cells of a organ, pancreas, is activated to release insulin. And this insulin is a carrier for that glucose molecule to the peripheral tissue so that it can be utilized. When it is overproducted glucose, then insulin is not able to transport all the molecules of glucose to the target cell, or in other words, all the molecules of glucose is not being utilized. So what happens? There is a rise in glucose level in the blood. But it's not only that. Then liver is activated to store this unused glucose as a fat for later use. Whenever it is crisis, it is being used. This is the work for insulin. Similarly, there is another hormone, glucagon, which is activated by liver when there is a crisis of glucose, when there is a fall of glucose level in the blood, or there is an extra demand of glucose. Then glucagon is activated by alpha cells. Alpha cells, there are two cells, like I mentioned about beta cells, which releases insulin. Likewise, there is alpha cell which releases glucagon. Now, glucagon helps liver to convert the stored fat back to glucose, and this glucose is being utilized. This is how the homeostasis maintains, means the balance maintains by low or high glucose levels. So I already mentioned 1 out of 5 people are suffering from diabetes. So who is at risk? Let's see. The risk may be divided into various categories, but we are talking basically on 3 categories. One category is non-modifiable, which we can't change, which is inbuilt in our, you can say, your destiny. I would rather not use the word, but this is what your body has. Your family history, you can't change your family history. Your age, you can't change your age. Your gender, you can't change your gender. Your race, you can't change your race. These are non-modifiable. Second comes the medical. There are many medical diseases, chronic diseases, which impacts metabolism either by developing diabetes or complicating the diabetes. Likewise, PCOD, hyperlipidemia, thyromegaly, fatty liver, chronic kidney disease. These are the things which can be easily managed, maintained, treated by medicine. But this has impact on diabetes, whether to develop or whether to complicate. Third comes the modifiable. This is very interesting part. This is why we say diabetic type 2 diabetes is related to lifestyle. Now, what is this modifiable risk factors? These are like your weight, your lifestyle, the living habits, your stress, your health behaviors, like consuming alcohol, tobacco, smoking, these type of things. Overall, faulty diet. We in a fast life in this modern era, we are very much fond of commercial food, fast food, because we don't have time. We want to munch fast. We want to get to the work. So this is a big culprit of type 2 diabetes, or we can say all type of metabolic disorders, or else all chronic diseases. So now let's see what we should look for. Many people, if you see, if you are saying 1 out of 5 individuals suffer from diabetes, so if you see, there are 6 out of 10 people, they don't have a family history. They even don't know whether they are suffering from diabetes. Accidentally, by any testing or visiting a health camp, they find, okay, you are diabetic, you are pre-diabetic, or you are uncontrolled, you are having uncontrolled glucose levels. So that time, the individual identifies, come to know that he is suffering from diabetes. But if you say, if you ask the individual, you don't feel anything. No, I don't feel anything. So what we should look for? So diabetes presents many classical symptoms. You have to identify. These are the signs and symptoms which your body is presenting itself to make you understand that the body's physiology is on stress. Like frequent urination, increased thirst, frequent urinary tract infection, blurred vision, unknown weight loss. Without the reason, you're eating well, you're having everything well, but still you lose weight. Pruritus, itching on the skin. There is no eruption, still you feel itching on your skin. Increased hunger. So these things are very much identifiable. Now, the next comes, there are few other symptoms also, which many of the times is being get biased. People don't feel that these may be the symptom for diabetes or associated with diabetes. Like individual may frequently get sense of confusion or brain fog. In females, there may be recurrent infections, never feeling of being well. There might be itching, there might be burning urine, many symptoms will be coming frequently. And patient is suffering, doctors are treating again and again, but there is in the back end, there is something impacting it. So this is one of the things. Now, the similar way, 50% of the diabetic patients, the male patients, suffer from erectile dysfunction. Many people have uncontrolled diabetes, which lead to nerve impacted problems like formications, tingling, crawling sensation, numbness on walking. There may be many symptoms like this, which is on the lower, mainly on the lower extremity, but it comes in the upper extremities also, in the fingers. Also, interestingly, diabetic patients are more prone towards genital warts or ulcers, generally what we call diabetic ulcers, diabetic foot. If you don't treat it properly, it may lead towards gangrene. These are things, if you find anything, any symptoms, if you notice any symptoms, please don't neglect. Consult your physician, let the physician decide and diagnose, investigate so that you are in a safe hand. So now what? We understood what the basic is. What are the signs, symptoms? What should we be looking for? Now what? Now, this is the time you should make yourself understand that I have to set a goal. What is that goal? First, you know your limitations. You must also know whatever you are doing, what will be the outcomes and how you are going to manage this to live healthy and even being with diabetes. So this is the goal, and goal should be realistic and it should be achievable so that you can fight the spike of glucose in your blood. Only you can fight the comorbid conditions of your body, either from developing a comorbid condition or managing the comorbid conditions. So how we will do it? Simple. That's the reason we have very simple this. 1 second, please. Yeah. So what should we do? We simply say, beat the diabetes. Now, why we have taken a beat? Even the webinar series for this is DiaBeat. We are beating the diabetes. What this means? It means be always physical, doing exercise, physically active, any sort of physical exercise you want. You can go for walking, you can go for jogging, you can go for running, whatever you like, you can do, but be physically active. Don't be living in a sedentary lifestyle. That is most important. Second comes eat food that is low in glycemic index or less in calories. So whatever you eat, monitor what you eat, watch what you eat. That is very important. Then comes ABCs. A stands for always watch and track your glycated hemoglobin, what we call HbA1c. That gives 3 months of your average blood glucose. Don't rely on fasting or don't rely on random sugar more often. The main thing which will guide you is the HbA1c. That will tell you whatever you are doing, whether the medication, whether the lifestyle, whether the diet, whether the exercise, whatever things you are using to control your diabetes, whether it is effective or not effective. It shows the result. Then always monitor your blood pressure. Even you don't have blood pressure, do monitor it regularly. I would rather suggest every 15 days or in a month, you should check even if you don't have blood pressure. Always monitor your cholesterol levels. The entire lipids should be done every 3 months. That your doctor, if you are diabetic, if you are on medication, your doctor will be doing HbA1c along with the lipid profile in every 3 months. That is very important. But in toto, if we say a simple thing, you must check your total cholesterol frequently, at least once in 2 months. Avoid any form of smoking, whether it is oral tobacco, smoking, shisha, e-cigarette, anything. Last, the T. Always track, watch, treat your signs and symptoms. Never neglect anything in confusion of that is not related to diabetes. This beat is very effective. Now, today our webinar topic is for holistic care, mainly with the alternative medicine and naturopathy. So I will talk about being a specialist in homeopathy. So I will talk more about homeopathy, but there are few alternative and complementary medicines which are very effective in treating the chronic disease, like homeopathy, Ayurveda, Unani, Siddha, Chinese remedies, naturopathy. So in this, if we say homeopathy is safe, uses natural sources for making the medicines, remedies, and has no side effect. It acts on individual to individual, on individuals' signs and symptoms and sufferings. It is not as a genius. Genius means covering, treating mass people. It is individualized. And according to WHO, homeopathy is the second largest medicinal system used globally. Let's see a few homeopathic medicines which are very effective in managing your diabetes, reducing your blood sugar levels. First line of medicine is Cyzalgium jumbo. It has anti-glycemic, dyslipidemic, anti-inflammatory, and cardioprotective properties. What we in India we call it jamun, the black plums. These are very effective. So symptomatically, it acts on increased thirst, increased urination, high specific urine, which has protein, especially the albumin is leaked to the kidneys and it comes to the urine. Also helps to heal the diabetic foot or any ulcer which is unhealing, very slow healing, which has a tendency to undermine and go towards gangrene. It should be given Cyzalgium. It helps to do a fast recovery. Second, please. Okay. Sorry. One second, please. I think I have gone into, yeah, sorry. No, second medicine is Gymnema sylvester. Gymnema is known to be a sugar killer. It mimics insulin. It is loaded with gymnemic acid, which is strongly anti-diabetic, anti-sweetener. What is anti-sweetener? When we talk about diabetes, we are talking basically, I just mentioned low glycemic index food, means the sweet index. See, it is anti-sweetener. It works as anti-inflammatory. What it does? Immediately lowers the blood glucose levels, reduces the absorption, reduces sugar craving, reduces the glucose in the urine. These are very important signs and symptoms which Gymnema treats. Third comes Cephalendra indica. It also mimics the action of insulin and has strong anti-glycemic properties. It acts on bilious complaints like boils, carbuncles, unhealing ulcers, burning pains, numbness, increased urination, complete dryness of mouth, sticky mouth, increased thirst. Even if you have eaten full, you still feel hungry. and generalized weakness. That is a main symptom of a diabetic patient, uncontrolled patient. He or she always feel lethargic, lack of power. Next comes uranium nitricum. It wonderfully acts for polyuria, especially during night. Polydipsia means excessive thirst, excessive hunger, burning urine, incontinence of urine, enuresis, incontinence, you are not able to control the urine, means it makes the bladder weak. It makes the bladder sphincters, the walls weak. Does treat dryness of mouth, and it also works in pruritus. There is no eruption in the body, still there is an itching. It works wonderfully on that. There are other remedies like helonius. These are actually used for peculiar symptoms. Helonius, for instance, it is very good for protein in urine. If you are passing urine, it becomes frothy, means there is albumin in the urine. And if you go and check urine test, you will find albumin present in that. So Helonius works very good in it, and it helps to prevent any kidney complications during diabetes. Conium, wonderful medicine. Not only it covers generalized neurasthenia, means generalized weakness, but it works wonderfully on formications. Actually, it works wherever nerves are involved. The formication, tingling, crawling sensation, and feeling of numb while walking. Your soul becomes numb. Natrum phos, it controls digestive disorders, improves metabolism and assimilation. Abroma augusta works wonderfully into patients where there is unknown weight loss. Patient is eating well, he is having a good nutritious food, still he is losing weight. There is no relevant known cause for weight loss. Abroma augusta works wonderfully on that. Phosphoric acid. This is basically a medicine for general neurasthenia and neuropathy, where nerves are involved, where physical ability is very less. You don't want to do anything. You feel fatigued. Every time you feel fatigue. Similarly, phosphorus. Phosphorus, along with all these symptoms, is very good in activating the pancreatic tissue. It treats all the pancreatic diseases, whether it is inflammation or swelling or any infection in the pancreas. Whether there is any tubercular diathesis, whether there is nerve weakness, whether there is erectile dysfunction, phosphorus is very good remedy on that. These are all other remedies which specifically treats particular symptoms, signs and symptoms, which your doctors identify. Okay, now, so we talk about, whenever we are talking about diabetic management, there are two clear aspects. One is the medication, whether you are taking allopathy medicine, homeopathy medicine, Ayurvedic medicine, whatever medicine you are on. The second aspect is your care. Now, that care is managed, we say as lifestyle modification management. So, that includes various things: proper diet, your exercise, your stress management, your health behavior, along with certain items which is easily available at home. You can say it's herbal because Chinese use as an herbal thing. Ayurveda use these things as an herbal thing. So these are easily available at your home. You can use this to promote your care, means enhance your care. So whenever we are talking, this natural remedies are beneficial, like turmeric. The cold infusion of turmeric, raw turmeric, I'm not talking about the powdered, I'm talking about the raw turmeric, is very beneficial in treating many symptoms of diabetes, especially the inflammation and any infectious disease. Sorry. Professor was mentioning about these things like fenugreek. It is very wonderful herbal thing. What actually it contains, why it is so effective? Fenugreek contains galactanon. This is an active ingredient which works like insulin. You may be surprised, but it's true. It mimics the function of insulin. It helps glucose to carry. It's not like mimics means it works like the function of insulin. It is not insulin. Insulin carries the glucose to the target cell. Fenugreek galactanone helps insulin to activate more faster and to take glucose to the target cell. Bitter gourd, Karela. The name is bitter. Why it is bitter? Because it contains saponin and terpenoids. These make the gourd bitter in taste. And why this is used for fighting a diabetes? Because it directly counters the glycemia. It has anti-glycemic reduction capacity, so that whatever you eat, it makes a filter for glycemia, and your body doesn't find suitable for releasing glucagon. If your glycemic index is low, so what happens? Your sugar level will fall fast. If your sugar level will fall fast, then glucagon is released and liver will again restart converting the fat to glucose and your sugar level will again rise. So this saponins make a filter on that. Like aloe vera. Aloe vera is also very wonderful thing what we eat. Aloe vera promotes your immunity. It promotes the hormone, mainly it promotes the hormone secretion. It promotes the immunity, and it helps the metabolism to work faster and in a proper way. So whatever you eat is being absorbed properly and assimilated and given to the target cells. Psyllium is very good because it is high in fiber content. And with high fiber content, it cleanses your intestines. It helps to reactivate the fat. And fat is utilized in a proper energy way. Cinnamon, again, wonderful herb. It contains cinnamaldehyde, which again mimics the insulin. Now, with the help of this mimic function, it helps insulin to act faster and proper way so that glucose is regulated properly. Giloy, Tinospora, is again an Indian herb found mostly in Southeast Asia, mainly in Indian continent side. It's abundant on that. It is known to reduce the blood sugar levels, right? Ginseng. Now, this is very important herb, and this is being used for many reasons. I would rather simply say ginseng is a very strong herb which gives your body immunity, which improves the metabolism, which increases your energy levels, which increases your mind, which increases your mood, which reduces your stress, induces your sound sleep. So many of the times now in the chronic disease, wherever the doctors are treating, they give supplement which includes ginseng too, because ginseng is very wonderful in effect. Now, there comes role of micronutrients. This is very important. Likewise, I said there are many symptoms which are treated by medicine. There are many symptoms, many more symptoms which cannot be treated by medicine itself. Where whatever we do, we have to supplement to strengthen them. Like for an example, the neuropathy, what we were talking about neuropathy, the formication, tingling, crawling sensation, numbness, that clearly indicates your nerves are impacted. So you need to support that nervous system. I just mentioned as an example. So what we do, we should be eating a right thing, right time, small portions, frequently, maybe number of times, and always use a proper food which contains vitamins and minerals. So when we are talking about vitamins, so vitamin E, which is very effective, it's very important vitamin which has in plenty of antioxidants, helps to repair and prevent cell degeneration and reduces the degrading of insulin. Degrading of insulin, you remember in the earlier slides, I was talking about if insulin impairment is like what? Either there is no insulin, less insulin, ineffective insulin. So even insulin is produced, it is not that effective. So there are many factors which make the insulin degraded, means it is not that effective. So vitamin E works on that also. It prevents degrading of insulin. Soybean, sesame seeds, cotton seeds, corn, these are rich source for vitamin E. Similarly, vitamin B3, it is very good for beta cell function. What beta cell does? This is the cell which produces insulin. And what insulin does? Everyone knows, we have already spoken about it. Insulin is the main carrier for your glucose molecules to the target cells. So vitamin B3 helps to promote beta cell function and lipid metabolism and also protein metabolism. Red meat, fish, especially sardines, bananas, complete ripe bananas, fortified cereals. These are rich source for vitamin B3. Then comes vitamin B6, helps in red blood cells, RBC formation. Now, this is the main RBC which helps to maintain the hemoglobin. And that hemoglobin is responsible for carrying the glucose for a time, 120 days. And that is the reason when we talk about glycated hemoglobin, means we are checking how much hemoglobin is effective to carry the glucose. So vitamin B6 is very important for promotion, health, formation, developing, manufacturing, maturing the red blood cells. Many things for all red blood cells, vitamin B6 is important. Even it is very good for neurotransmission. Nerve transmit from one nerve to another nerve through a transmission channel. And there, vitamin B6 has an important role. It regulates serotonin and dopamine. Serotonin suppresses your hunger. Dopamine increases your hunger. Dopamine increases your mood. Serotonin reduces your mood. So there are few things which regulates stress. Vitamin B6 is one of that important component for that. Chicken, fish, peanuts, soybean, banana, everything is having vitamin B6. Now, vitamin B12, again, this is also helpful for RBC formation. It also helps to promote hemoglobin. So it prevents anemia. Organ meats, fish, like sardine, tuna, trout. These are the fishes very good for preventing anemia and promoting RBC formation. Red meat and fortified cereals. Vitamin C. Everyone knows vitamin C is very helpful in cell growth and repair. So helps regular ion exchange, preventing oxidation of insulin. This is again important. Degrading and oxidation means if insulin is present, if it is degraded, it will not be effective. It is oxidized, it will not be that effective. So it has to be raw and effective. So vitamin C works very good on that. So where we can find all citrus food, so we find vitamin C. Okay. Broccoli is also having, Brussels sprout is also having, bell peppers are also having. So these are good source for vitamin C. So now, when we talk about vitamins, then we are talking about minerals also. Now, there are many minerals we are eating, whether it is in abundant or a trace element, but we eat. And when we are talking about diabetes, so we will talk mainly about magnesium and chromium. Why magnesium is important? Magnesium helps in metabolism. So everyone knows food is digested, food is converted to glucose. It all comes under metabolism. Also, magnesium is very important component for a neurotransmission. Means nerve to nerve conduction is also done by magnesium. Acts as an anti-inflammatory and regulates your mood. So where you will get magnesium? Pumpkin seeds, almonds, peanuts, black beans, avocado, kidney beans, yogurt, broccoli, wheat germ. In toto, if we say, if you eat a sufficient amount of seeds and nuts every day, you will be having magnesium as well as chromium. Now, what chromium does? Chromium again has very important role in diabetes management. Chromium promotes insulin sensitivity. What we say when we say ki, type 2 diabetes is mainly due to insulin insensitivity, means insulin resistance. If insulin is not being allowed to enter any cell, so it will not carry the glucose and develop it to the cell. So chromium promotes the sensitivity of insulin to the cells. Where you will get chromium? All protein foods like lean meat, poultry, eggs, seafood, beans, lentils, all nuts and seeds, just I mentioned. So this is very good. Now, third comes enzymes. So there are many enzymes. Nowadays, many anti-diabetic medications, what we are using, like metformin and glucophage, what many medicines we use, these medicines have effect on the enzymes also. So what are the important enzymes we use and which is very important for diabetes management? That is glucokinase, carnitine, biotin. These are responsible for regulation of insulin, whether it is production, whether it is promoting the sensitivity. And where you will get this? You will get glucokinase, carnitine, and biotin on egg yolks, nut seeds, organ meats, mushroom, broccoli, banana. These enzymes promote the glucose absorption pathway, means it makes the channel proper so that insulin takes the glucose properly to the target cell and the cell uses it properly. Then comes polyphenols. It's a strong antioxidant, means it prevents oxidification of insulin and all other enzymes and minerals and vitamins. If you have free radicals, then it will be damaged. So it will not be used. The polyphenols are very useful. From where you will get the polyphenols? All colored vegetables, mainly the green leafy vegetables and fruits. Okay. So that's the reason doctors used to say, dietitian and nutritionists used to say, eat a rainbow of fruits and vegetables. That's the reason why we say. Then comes leptin and ghrelin. These are the enzymes which regulates your hunger, and this is regulating your fat metabolism. Now, leptin increases your hunger, ghrelin reduces your hunger. So balance should be there. This balance is very important to regulate your hunger so that and to regulate your fat metabolism. Wherever you require energy, you don't feel hunger and stored fat is being reconverted to sugar and being utilized. So this leptin and ghrelin is very important. Then comes cortisols and neuropeptides. These are again enzymes or hormones which regulate your stress, influence the fat metabolism. Where you will get leptin, ghrelin, and cortisol and neuropeptide? You will find in berries, neutral oils, like what we call virgin olive oils. So why we call it virgin olive oil? Because that is neutral. Leafy vegetables, all green leafy vegetables have these things. Legumes, salad greens, these are good source for leptin, ghrelin, cortisol, and neuropeptides. So if you simply think about it, it looks very technical, but everything you are eating, I'm just enhancing why we need to eat these things and why we should prefer these food items for a better health. So whatever we spoke about, so now third point comes about diabetic management is the foot care. This foot care is very important because we have already mentioned many patients suffering for diabetes for a long time, they may be having formication, tingling, crawling sensations. That means the nerve is impacted. And generally, the nerves of extremities are impacted. Forearms, lower legs, these. If you have neuropathy in the lower legs, it is very lethal, fatal. Why it is fatal? Because if you are not able to, like I say, many patients feel numb in the sole while walking. If you feel numb, then you may by accident step on a splinter and that will prick in your skin. You will not be able to feel that pain. You will neglect it because you didn't feel that. Now that will, and being a diabetic patient, there is reduced healing process and there is increased chance of getting infected. And being a soul, it will be coming in contact with dirt and other things frequently. So it will be infected and it will become ulcerative, and that's the thing what we call it diabetic foot, and it may lead towards gangrene. The worst case, it may lead to amputation of the foot, depending on the type of gangrene. So what we should be doing on a regular basis to take care of it, to prevent a diabetic foot or to have a proper foot care. If you have uncontrolled diabetes, if you have high glucose levels, if you are on medication for strong medication means high doses of sugar levels, medications to control your sugar. That means there is very much strong reason for diabetic control, and that may lead towards a problem. So what you should be doing? Wash your feet with lukewarm water. I would rather suggest every day while going to bed. And while you're washing, just inspect your sole. You can use a mirror, like in the image it's being shown. Just look around whether you have any corns, any callocytes, any hardness, any boil, any cut on your soles. Especially it will be below your toes. If you have nails, ingrowing nails or long nails, always trim it. Ingrowing nails are very much dangerous. Watch for callocytes, already I mentioned. But if you see any callocytes or corns, don't cut yourself. If you are office going person, if you are a working class person, if you use shoes every day during your work time, more than 10 hours a day, then always, and you are diabetic, so always keep changing your socks and stockings so that there is less chance of any fungal infection to establish. Always keep your foot dry. Very interesting thing. Don't walk barefoot. There is many theories in the internet where you'll find early morning, if you walk barefoot on the grass, your eyesight will increase, your metabolism will increase, your blood pressure will reduce, many things, blah, 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 blah. Many things there you'll find it. But nothing is being certified scientifically. In fact, it may lead towards, if you are diabetic, if you are having a high glucose level, It may lead towards diabetic foot. It may lead towards injury in your foot unknowingly, accidentally. Plus, also one thing, don't go for fashion. Making a fashion using a fashionable shoes and other things in the footwear, compromising your means comfort is not good. Always use a proper fitted shoes so that your sole and shoe is your foot is comfortable. There is no chance of callus or conforming. If you have a tight fitted shoes, if you are improper fitting shoes, you will develop cons and callocytes. So let's recap. So whatever we spoke, and every time for last 3 years we are doing every sessions we are saying the thing. But what we emphasize more and more for you to learn things are always have a regular checkup. If you are diabetic, sure shot. If you are not diabetic, even if you have family history, even if you have pre-diabetic conditions, if you have high blood pressure, if you are on medication for high blood pressure, always keep watching your sugar levels. Monitor your signs and symptoms. I have already mentioned about many signs symptoms which are classical, which are irregular, uncommon symptoms which are not easily identifiable. But I have given a means simple picture for you to understand. So always keep on monitoring your signs and symptoms. If you have all any medical conditions, monitor it properly. If you are on medication, take your medication properly and regularly. Don't skip and don't regulate your medicine yourself. Let your doctor do it. Avoid extra or simple sugar. Don't add any extra sugar to anything. Try to avoid caffeine and juices. We simply, when we talk about the diabetes, we simply say, eat a fruit, don't drink a fruit. Many people say, okay, after exercise, I'm drinking a juice. I make juice myself. I don't put sugar on it. No, drinking a juice is not good for a diabetic patient, not good for obese patient, not good for cholesterol patients where triglycerides are high. So avoid a juice, whether it is commercial, whether you have made it at home. No juice. Eat a fruit, any number of fruit, any fruit, no problem. Avoid tobacco in any form, whether it is oral, smoking, shisha, anything, any format. Avoid alcohol. Alcohol disturbs your metabolism. Alcohol reduces your good cholesterol, increases your triglyceride, increases the insulin resistance, increases obesity, promotes more fat storage. Means your glucose is not being utilized by the target, it is being reversed and instructed to stored as a fat for later use. Alcohol is that problematic. Avoid commercial food. Once in a while, I would not say don't go for it. You can, but don't make a habit. Not more than once in a week. Do a regular exercise, any format of exercise you want, you love, you can do. But for diabetes, what we say, cardio and strength exercise are more important. Main ratio 60-40, you can say 60% should be a cardio exercise, cycling, walking, whatever you wish, you can go for it. And 40% for strength, which strengthens your muscle, because muscle wasting is very common in diabetic patients. And not last, manage your stress. If you are having a high stress, wherever the stress is coming from, home, work, your profession, your daily routine, whatever it is, manage your stress. This will help you to fight diabetes very well. Thank you very much. So I'm open to questions. So any questions we can take on. Professor, over to you.
Doc W, thank you so much, sir. Thank you so much. Now, if I were to look at your uh, presentation, and I've paid close attention, uh, three or four things strike me. You spoke about supplements, you spoke about naturopathy, homeopathy, and so I'm going to touch upon, if I may, these three aspects. Let's look at what you mentioned about supplements. You spoke about enzymes, leptin, ghrelin, and cortisol, etc., and their benefit for insulin. You spoke about vitamins, vitamin E, B, C, and the great benefit that they have on the nerves and protein synthesis and things like that. You spoke about minerals, magnesium, chromium, and their relevance to insulin and metabolism. I'm thinking, Doc W, about a magic pill. Now, you've spoken about these supplements and micronutrients. I would love to get your thoughts on what if those of us who have diabetes talk to our doctor about getting a multivitamin, multi-mineral, multi-enzyme pill. Wouldn't that be so helpful to us? Doc W.
So, definitely. Whenever we are talking about, that's the reason I mentioned about, when we talk about diabetic management, we definitely have different protocols. So two protocols for a diabetic management go side by side. One is the medication, whatever the medicine is being used to reduce it, and second is to manage it holistically. So holistically, because the doctor, treating doctor is always mentioning about two things: controlling your diet and doing an exercise. They don't have that much of time to explain the patient what exactly to be done, and that's the reason they refer it to the dietitian. Dietitian makes the plan. So this, if we speak about the holistic care, there are different aspects of it. Diet is one part, exercise is one part, stress is one part. In diet, you have different streams. One is the caloric aspect of the diet, what you are using, whether it is calorie deficient or whether it is hypoglycemic. And second, the supplement and micronutrients, what I was talking about. These actually promotes in many aspects for improving your metabolism and improving the insulin sensitivity, improving the utilization of insulin, and improving the immunity, reducing the degrading of insulin. So there are enzymes, leptin and ghrelin. So this, even nowadays, many medicines like metformin has an effect on ghrelin. Ghrelin increases your hunger. So metformin controls the hunger. That is actually not meant for controlling it, but the study showed it helps to do that. So even in the pre-diabetic conditions or obese patients, glucophage is being used. That's the reason. So if you have controlled ghrelin, means you are not, means your hunger is being controlled. If your hunger is being controlled, you will be very choosy to eat. You will be eating less. You will be feeling full when you eat. So this is the way why the holistic methods should be implemented along with the diabetic management.
Good, good. Doc W, the second is an observation. Uh, all our medical colleagues, including you, of course, all our medical colleagues talk so much about lifestyle as being supportive of medicine, medication, and as a consequence, beneficial in this instance to diabetes. Now, by what you have mentioned, you spoke about naturopathy, and in naturopathy, you touched upon yoga, which is, if I may uh, mention it, it is a form of perhaps exercise, movement, and relaxation techniques and breathing. You spoke about naturopathy in terms of its diet. So would I not say that? Would you not agree with me if we say that naturopathy and lifestyle are more or less similar? They are almost twins in their end objectives of managing good health by day-to-day living. Would you agree with me, sir?
Yes, very much sure, sir. That is absolutely correct what you said. So, yoga, exercise, or any format of lifestyle modification, and is really twins. You should be doing it together. Without each other, it is not being complete. So you must do that. Everything. That's the reason when we are when I said about the goal, you should be knowing about your limitation and the outcome of your work. Every individual has a different capacity to do it. Some person can go for a running, so some person cannot go because he has a joint pain, so he cannot go for a running or walking. So he can do yoga, he can do swimming. So alternative methods he can do to get the maximum benefit of the exercise.
My third question, and perhaps my most important question, not my most important question, but I, I don't know how to present this, Dr. Vilku, so I'll give it to you without thinking. We all hear about homeopathy, and we all hear good things about homeopathy. And from what you've spoken, and if I may look at the little notes that I've made, you have spoken about the correlation and the benefits of homeopathy with on ulcers, reducing urination, fatigue, infection, neuropathy, nephropathy. I've heard these words mentioned by our allopathic physicians also. So I see a tremendous parallel between homeopathy and allopathy. And so my simple question is this. As a specialist, sir, as you being the specialist, my simple question to you is this. What if I take a parallel course of allopathy, of homeopathy, along with my allopathic medication for diabetes? Would it not be, in my mind at any rate, psychologically, it will give me, in my mind, double the benefit? Now, what would you recommend as a specialist? If I decide, Dr. W, I come to you in your clinic and I tell you, sir, I have high blood sugar and these are my medicines. I've heard good things about allopathy and I do not want to listen to you because, well, it is beneficial to me. But I also want to take the benefit of homeopathy. Can you recommend something for me that can go with my allopathic medication? What would your thoughts be on that, sir?
Very interesting question, sir. This is very common question nowadays. People are very much in means inquisitive about this, whether that it can be taken along with the regular medication or not. Very much correct. Now, I would, before going into that, I would simply, little bit in a simple way, I will elaborate the signs and symptoms. Like even in our earlier webinars, our internal medicine endocrinologist, whoever the speaker was, they have mentioned about the signs and symptoms, right? So whenever these signs and symptoms come along with treating a diabetes, what happens? The conventional medicine specialists, the allopaths, they focus on the disease in toto, means their main focus is to control diabetes. Once diabetes is controlled, these symptoms will reduce. That is clear concept of conventional medicine. No dispute on that. But what happens? Many of the times, these symptoms are so flared up that conventional medicine is not able to manage it. I'm giving one aspect of the uses of homeopathy. So there, if a person comes with diabetes, controlled diabetes, one condition may be controlled diabetes, along with some other problems like recurrent urinary infection. Say, for an example, if a female comes with UTI and the gynecologist or the treating doctor is frequently giving antibiotics because they don't have an option. It goes, again it comes. It goes, again it comes. The culprit behind the scene is diabetes. And they are controlling the diabetes. Whether it is being controlled or not controlled is a separate issue. Their homeopathy helps wonderfully to reduce the recurrence and frequency of UTI. Similarly, in formation and tingling, like neuropathy, brain fogs, their homeopathy supports wonderfully to fight these signs and symptoms. In other words, if you say, if somebody comes to me as a practitioner in my clinic and say, I am fed up of taking medicines for so long, my sugar is not controlled, I want to stop this, I want to start homeopathy, I would never suggest it. The reason behind it, so long your body, the patient's body is being used to, addicted to the medication what he was taking. If he stop and shifts to any other alternative medicine, whether it is homeopathy, Ayurveda or whatever, it will not work that properly, because these alternative medicines are promoting the natural health and the conventional medicine is directly focusing on controlling the sugar levels. So what I would rather suggest, if that is an uncontrolled condition, if the patient is not very happy with the treatment, not happy with the management, I would rather suggest continue your medicine. I will support with homeopathy for your comfort, and whatever discomfort symptoms you are not able to control, I will help it out. So simultaneously, these medicines can work properly without any side effect. There is no interaction between these medicines.
Yes, Dr. W, yes, you have used the magic word, no side effects. And that is remarkable. I can assure you, sir, that I will be calling your office to make an appointment so that I could uh, parallel my medication with your homeopathic remedies. Now, Dr. Wilku, and my dear participants, I have to apologize for what shall I say, capitalizing on Dr. Wilku's presence by asking all my questions so selfishly. My apologies for that. And I have to tell you that we have run out of time. So, what I am going to do is, I assure you that I will pass on all the questions that I have received, and I have received several questions uh, uh, about a grandfather who has crawling and numbing sensations. Will homeopathy help? Uh, uh, if I take homeopathic medicine, can I stop my regular medication? And Dr. W has already said, no, you must continue with your regular medication. And then there's another question which says, I have swelling. So is it diabetes or is it the kidney? Sir, we've run out of time, so I am going to pass all these questions on to you with a request that you answer them. Is that okay with you, Dr. W, sir?
No problem, sir. Sure, we will reply to that.
Okay. And now, from the bottom of my heart, sir, thank you so much. Thank you, Dr. Wilku. Thank you so much for an excellent presentation. In many ways, a controversial subject. I mean, here am I sitting in a hospital, and here are we talking about alternative therapies. It takes a very powerful speaker with a lot of knowledge to speak about that in a medical institution. Thank you so much, Dr. Wilku. Our dear participants, thank you so much for what shall I say, for supporting us all the time by coming to our programs. And we will upload this within minutes so that many more participants can see it and partake of it. Uh, my, my thanks to the Arabian Wellness team and the RAC Hospital team, especially IT, for the support that they gave us. You do know that we had a glitch earlier in the day, and it was swiftly resolved by the IT team. Thank you for that. And gentlemen, ladies, and my dear colleagues in the Diabetes Challenge, we will see you again next week. That is on the 27th. We will see you again. And thank you. I notice, oh yes, efficiency personified. I can see the slide up there, and it will remain for all of you to see in due course also. Thank you so much and good day. Once more, thank you so much, Dr. Wilku,
Thank
and
you.
good day, everyone.